Hi students, and thanks for joining me again for our Techniques and Procedures class. We're getting really close to the end of our year here, our end of our semester. I know it's a hard time of the year to keep focused, but do so. Only a few more weeks to go, a few more assignments for our class. Hang in there, I know you can do it. This week we're going to talk about Chapter 10. We're going back a few chapters to Chapter 10 for grammar review. We're going to talk about antonyms, what those are. We're going to review eponyms. We've talked about those already. We're going to just do a quick review on those. Most of our focus, however, will be on homonyms or sound-alike words that can be difficult for us, whether we're writing in English papers or whether we are doing medical reports. So let's get started with Chapter 10. And this chapter I've set up again as a question and answer for several of the slides. So I'll ask a question and you can decide on your own, think about it, click to the next slide and see the answer. In the classroom, I actually hand out what we call eye clickers. I don't know if you've ever seen those before, but they're little remotes that the students can choose A, B, C, or D. And that's how we do it in the classroom. But for us, we'll go ahead and kind of do an answer question. And that's how I've got this set up. So we'll start with Chapter 10. Antonyms, eponyms, and homonyms can give us a lot of challenge with our writing. Again, whether we're doing English papers or whether we're transcribing medical reports, and they're often considered word demons for us. So let's take a closer look at these. Here's our first answer question slide. Antonyms are they A, words that sound alike but are spelled differently and have different meanings? Antonyms are B, words derived from the name of a person who has done something notable in medicine. Are they words that are spelled alike but pronounced different and have different meanings? Or are antonyms D, words that have opposite meaning? Think about that. Click to the next slide. Antonyms are words that have opposite meaning. And just a few of our hundreds of examples: up, down, hyper, hypo, abduct, adduct. And you can see that the medical antonyms have even more of a challenge because they sound a lot alike, spell different, and definitely mean different things too. Antonyms might be a whole word, prefix, or a suffix that have an opposite meaning from another word. And as just stated, medical antonyms are even more challenging because they really sound a lot alike. And then you add a dictator who is dictating 1,000,000 miles a minute, and they get really sounding a lot alike. So you really have to understand not only what they're saying, how to spell it, but does it make sense? And that's the underlying thing with anything we're doing with medical records is, does it make sense in the context of what we're talking about? And here's our next question answer slide. Eponyms are, and I hope you all get this one right because we've talked about this before. Are they A, words that sound alike but are spelled differently and have different meanings? B, words derived from the name of a person who has done something notable in medicine? C, words that are spelled alike but pronounced different and have different meanings? Or are eponyms words that have opposite meaning? D. When you're ready, click to the next slide. And the correct answer is B. Eponyms are words derived from the name of a person who has done something notable in medicine. And some examples are shown here, such as Foley catheter, Pap smear, Parkinson disease, Heimlich maneuver. Notice because these eponyms are derived from the name of a person, it's a proper noun. And remember our proper nouns? When we have a proper noun, we capitalize it. So that's why our eponyms are capitalized. Eponyms that are used for diseases usually have a comparable medical term, such as Berger disease is also known as thromboangiitis obliterans. Lou Gehrig disease is a pretty famous disease. We've heard about Lou Gehrig disease probably. It's for ALS, or amyotrophic lateral sclerosis. And there's hundreds of these where our eponyms also have a comparable medical term or another name for their disease. And just as a review, words that are derived from eponyms are written in lowercase. So Parkinson disease, Parkinson is the eponym to proper noun. It's capitalized, but Parkinsonian symptoms, Parkinsonian becomes an adjective form there, or a different type of word. Not, it changes the look and the meaning of the eponym. So there it is not capitalized. Cushing syndrome, Cushing is an eponym. Cushingoid facies, notice that word has changed. It's derived from the eponym, but it's not the actual name of that person anymore, so it's lowercase. Also, as a review, remember that we know that our eponyms consist of two parts. We have the main word or the noun, and then the adjective, which is the eponym itself or the name itself. So Rye syndrome. Remember that when you're looking these up and you're not sure how they're spelled, syndrome in this case is a lot easier to spell than Rye or Ray or however they're saying it. You might be like, what are they saying here, and what is it? I don't understand them. Look up syndrome and scan through the list, and you will hopefully find Rye there. And this is called cross-referencing. So a dictation that sounds like chain smoking respiration. Is that right or not? You know, as the new transcriptionist, you may think, well, that makes sense, doesn't it? We're talking about breathing and respiration. Might be chain smoking, which of course you're not sure, so you're going to look it up. How would you look up this term? Look up respiration, and then you will find what the answer is. Go to the next slide, and I'll show you. This one is actually Cheyne-Stokes respiration. And believe me, they don't say it as articulated as that. They say it very quickly. So chain smoking might really be what it sounds like. So look up respiration. You'll find it. Dupuytren contracture, Lennox cirrhosis. Notice contracture, cirrhosis, respiration, disease, syndrome. All of those are much easier to look up than the eponyms. So get used to doing that. And of course, this works best when you're using an actual book rather than on the internet. Here's our next question answer. Heteronyms are A, words that sound alike but are spelled different and have different meanings. B, words derived from the name of a person who has done something notable in medicine. C, words that are spelled alike but pronounced different and have different meanings. Or D, words that have opposite meaning. You can start to do a little bit of elimination here from the ones that we've already talked about. Go to the next slide to find out what heteronyms are. The correct answer is C. Heteronyms are words that are spelled alike but pronounced different and have different meanings. And here are a few examples of some heteronyms. To tear, such as to rip something, and to tear a sheet of paper, or tear, a tear fell from her eye. A present, like giving a gift or to be in attendance, or to present. The doctor presented at the conference. So for the most part, these aren't too hard for us as long as English is our native language. For those who have English as a second language, they might find these words to be a little bit more of a challenge. And our next question answer, homonyms are A, words that sound alike but are spelled differently and have different meanings. B, words derived from the name of a person who has done something notable in medicine. C, words that are spelled alike but pronounced different and have different meanings. Or D, words that have opposite meaning. And by process of elimination, I'm sure you all got this one correct. Go to the next slide. And A is the correct answer. Homonyms are words that sound alike but are spelled differently and have different meanings. We have hundreds of these words, and this is what we're going to really concentrate on this week, are these homonyms, words that sound alike, spelled different, have different meanings. Some examples, right, and right, counsel and counsel, it's and it's, there. As you know, there's tons of these in our English language. And these are the most difficult, whether we're transcribing or whether we're writing English correspondence, because spell check will not catch these. Sometimes they might give us the green underline on our word screen that shows that maybe there's a grammar error. Sometimes they won't. So just be aware that you need to know these because spell check doesn't always help. There are thousands of these words that sound alike, but mean different things and are spelled different ways. They're called homonyms, homophones, or sound-alikes. At this point, I would suggest pausing this lecture and going to Diagnostic Test 10-1 in your textbook. Complete at least numbers 1 through 20 and see how you're doing, kind of as a pretest. The answers are in the back of your book in the appendix area. Here are a few English homonyms to get us thinking about this. Advice, advise. Discreet, discreet. Affect, affect. Cite, cite, cite. Compliment, compliment. Principle, principle. Accept, accept. Incidence and incidence. So you can see that they sound very much alike, spelled different, and you know that they mean different things. We're going to take a look at each one of these individually. Choose the correct word here. The oncologist will advise the patient to undergo chemotherapy. Is it A, advice, or B, advise? Which one is it? The oncologist will advise. B is the correct one. Advice is a recommendation, usually a noun. Advise is to counsel or to notify, a verb. Try this one. The patient had total involvement of the right ovary and a discrete mass on the left. Which discrete is correct, A or B? Click to the next slide. The answer is B, discrete, D-I-S-C-R-E-T-E. In this situation, discrete means separate. And I always remember this by the T separates the E's, separate. That's one way to think about it. The other discrete means wise or showing good judgment. Affect can be a hard word to know which one to use, affect or effect. Let's look at this one. Drowsiness is one side effect of Benadryl. Which one, A or B? Go to the next slide. The answer is B, effect. Almost always when we're talking about side effects of drugs, effect would be an E. Let's try this one. The dark, cold winter months can affect people's moods. A or B, which one? The answer is A, affect. Affect with an A is a verb, almost always. There is one exception. We'll talk about it in a minute. And if you can think about to influence. So if you can switch out influence, that might be a good way to know if it's the A, affect. The dark, cold winter months can influence people's moods. Okay? Effect with the E is almost always a noun, meaning the result or the end result. Some people like that E for end result for that mnemonic device to remember. Sometimes using mnemonic devices can help us remember words like these, like affect and effect. So again, affect with an A is almost always a verb to act upon or to influence. You can use whichever one you like. I always think of influence, but some people do like the A for act upon. Don't let one bad moment affect your otherwise pleasant disposition. In that situation, it's a verb, affect with an A. The effect of poor attention is numerous mistakes, or the end result. In this situation, it's a noun, it's E, effect. We have a couple of exceptions here, but the one we're going to concentrate on is on the next slide. Let's take a look at it. On psychiatric examination, the patient's affect was flat. A or B, which one? A is correct, affect. And this, again, is an exception to the rule. It is almost always pronounced as a long A, affect. So here, affect is used as a noun to describe the emotional status of a patient. We don't usually use it very regularly in our everyday vocabulary, but for our medical reports we will, especially when we're talking about neurologic exam or psychiatric exam, such as the patient's affect appeared to be appropriate. So that person's emotional status was appropriate. How about this one? The site of the tumor was determined on the CT. Which site is correct? Letter D, site, S-I-T-E, is correct. So A, site, of course, is our eyesight, the function of seeing. B would be quoting an authority. So when you're doing a research paper and you cite a reference, C-I-T-E, C is actually a suffix meaning the cell, and D, of course, then is a place or location. The site of the tumor was determined on CT. Here's one that several people in my face-to-face class got wrong. The pearl necklace was a complement to the red dress. Which complement is correct, A or B? B is correct. Complement, C-O-M-P-L-E-M-E-N-T. Complement in this situation means that which completes. So the pearl necklace completes the red dress. The other complement is admiration or praise. Complement, C-O-M-P-L-E-M-E-N-T, is also a laboratory test, just so you know that too. Now let's look at the word principle. The patient's principal diagnosis was diabetes. Which principle is right, P-L-E or P-A-L? Take a look on the next slide. B is correct. Principle, P-A-L. Let's look at another one. Knowledge of correct transcription principles is essential to the career. Which principles is correct, A or B? In this sentence, A is correct. Principles, P-L-E-S. Principle, P-R-I-N-C-I-P-A-L, means main or head. P-L-E means rule or regulation. So I know a lot of us were taught, maybe in elementary school or middle school, that your principal of the school is your pal, P-A-L, and that is correct. But if you think a little bit wider about that, a little more global, P-A-L meaning main or head. So the principal diagnosis is diabetes, the main diagnosis, P-A-L, main or head. And then P-L-E is a rule, and P-L-E and R-U-L-E, they both end in L-E, so that's another way to think about that one. A rule, the principle, or the rules of correct transcription are essential. So that's one way to think about those two and differentiate. Let's look at another one. Accept, accept. The employee could not accept the expensive gift from her supervisor. Which one, A or B? The answer is A, accept, to receive or to take. Accept means to leave out, such as, I would like everything on my salad except jalapeno peppers. So everything but that, leave it out. How about incidents and incidents? The incidence of drug overdoses has increased. Which one's correct, A or B? B is correct, meaning frequency. The other incidence is subordinate to something else, or consequences or events. And we also might have to make the choice of a word being one word or two words, and what makes the difference. So we have to know the difference between some of these, what they mean. Already versus already, one word, two words. Already as one word means previously, such as I already submitted my assignment. Already two words means completely prepared or ready. I am all ready for the final exam. Altogether versus altogether. One word meaning completely or entirely, such as the opinions of the doctors were altogether different. Altogether two words meaning collectively or in a group. The team altogether presented their findings. Everyday versus everyday, one word, two words. Everyday one word means ordinary, such as the student wore her everyday clothes, her ordinary clothes. Everyday two words means each and every day, such as I am thankful every day. Two words, every single day I am thankful. That's the other way you can look at that. If you can put in the word single, every single day, and it makes sense, it should be two words. Everyone, everyone. Everyone, one word, meaning all persons. It's plural, such as everyone attended class. Everyone means each and every one, just like every day, if it's two words. Every one of the students earned an A on the final exam. Each and every student earned an A. So that's how you know if it's two words. One of the tricks there. The words who and whom can be a challenge for many of us. How do you know which one to use? Well, if you can substitute he, she, or they, we would use the word who. If you can substitute the words him, her, or them, use whom. Let's look at who and whom a little further here. Let's look at an example. Who or whom is going to the AHDI National Meeting? First, let's separate that clause that has the target word, and let's disregard the rest of that sentence. So, who or whom is going? Forget the rest of the sentence, okay? Makes it easier for us to figure this out. Now we're going to substitute it with he or she, or him or her. Which one makes sense? He or she is going? Him or her is going? Which one makes the most sense? In this situation, who is the correct answer? Your book does have a few more examples for you to go ahead and try for 10-6. So you might think about stopping our recording right now and doing 10-6 in our textbook and reinforcing some of these rules of who versus whom. At this point, I'd like to call your attention to a homonym chart that is in our Appendix B of our textbook of everyday homonyms. Gives us quite a few different examples here of this chart. You might consider ripping this out and putting it into your information stations when we're done with our class here. The only downfall is that it does not give us definitions. So if you're not sure which one it is, you would have to look up the word. But again, take a look at Appendix B for your everyday homonyms. As someone fairly new to the medical language, our medical homonyms, again, might be a lot more challenging for you, such as perineal or perineal. Do you know the difference? The first perineal is concerning the fibula or the bone, and I always think of there's an O in there, O for bone. The other perineal is situated on the perineum, or the structures comprising the pelvic floor. Let's look at the next three here. Dysphagia, dysphasia, dysplasia. Let me tell you, those sound an awful lot alike when they're dictating at 100 miles a minute. Dysphagia, the first one, is an inability to swallow or difficult swallowing. How about dysphagia? Do you know what that is? Dysphagia is an impairment of speech or difficult speech. Dysplasia, then, is abnormal development of tissue. Absorption or adsorption. Again, sound an awful lot alike. Absorption means to soak up, such as a sponge. Adsorption is the attachment of one substance to the surface of another. And we hear this a lot in, for instance, like emergency notes. The charcoal was responsible for the adsorption of the poison. So when somebody has come into the emergency room with poisoning or maybe drug overdose, they put charcoal in the stomach to adsorb or to attach one substance to the other. You might have heard that before. How about illicit or illicit? Sound alike, don't they? The first illicit with the E means to draw forth. It's a verb. The other illicit is illegal, such as illicit drugs. That's usually where we hear that one. So illicit drugs will make you ill is another way to remember that, or a mnemonic device for that one. Let's look at a couple of these a little bit more in detail, as well as some other ones too. Let's review the word follow-up. In this case, which one is correct, A or B? The patient was asked to follow up in 4 weeks' time. Which follow-up? Go to the next. The answer is A, follow-up. 2 words. The verb. So again, to review, follow-up 2 words is a V. Follow-up 1 word is either a noun or an adjective. The follow-up appointment is today. How is follow-up used in that sentence? What is it? Is it a verb, a noun, an adjective? What is it? Think about it a minute. Here it's as an adjective. It's 1 word. The patient did not return for follow-up. In this case, how is it used? It's a noun, 1 word. He will follow up with regular visits. What type of word is it there? In this situation, it's a verb. He's going to do something. It's action. 2 words, verb, follow-up. How about this medical term? Examination of the neck revealed shoddy nodes throughout. Which shoddy is correct, A or B? Go to the next slide when you're ready. This answer might actually surprise you. I know it did in my face-to-face class. It is B, shoddy, S-H-O-T-T-Y. Shoddy, resembling buckshot or lead shot that's used like in gunshot shells or BBs. That's what we're talking about here. I couldn't find a picture of BBs, but here's some marbles. So shoddy nodes, they're tiny little like beads where you might find lymph nodes. That's called shoddy nodes, S-H-O-T-T-Y. The other shoddy, A, is resembling poor workmanship or quality. So that one is not correct. So again, this one might have surprised you. All right, you should all get this one right. We just talked about dysphagia, dysphagia, dysplasia. Which one is right? He had blank after his esophageal dilatation. The answer is B, dysphagia, or difficult swallowing. So looking at these 3 words, again, dysphagia, difficulty speech, S for speech, might help you to remember that one. Dysphagia, G for gag, if you think about that, difficult swallowing. Dysplasia is poorly formed. So again, because these words sound so much alike, you're going to need to critically think about what you're transcribing. It needs to make sense in the context of our report and what the doctor is referring to. You might need to look these up and just make sure you've got the right one. How about this one? The GI tract was clear of evidence of tumor invasion. Which tract is correct? A or B? The answer is A, tract, T-R-A-C-T. Whenever we're talking about anatomy, especially with a series or a system of related parts or organs, it's T-R-A-C-T, such as biliary tract, urinary tract, respiratory tract, GI tract, all of those. Make sure you're using T-R-A-C-T. That's the correct one. How about this one? Social history reveals the patient served a 2-year stint in the Army. A or B? B is correct, a stint, a period of time doing something. Letter A, a stent, then, is a medical term meaning a slender thread, rod, or catheter inserted into a tubular structure, such as a blood vessel, or to provide support during or after an anastomosis. And stent is actually named after Dr. Charles Stent, who was a dentist. And you might think, well, then that should be an eponym, right? It should be capitalized. Well, this is a good example of how our language evolves, and stent has become so widely used that it's actually dropped that capital S. We have a few more examples here. How about this one? Ilium or ilium? The 80-year-old female suffered a fractured ilium after a fall. Which one's correct, A or B? B is correct. This ilium means the superior portion of the hip bone. If you think of the double I's for our hips, that's one way to remember that one. The other ilium is the distal portion of the colon. Let's look at this one, workup. The patient will return for a workup in 6 months. A or B? A is the correct answer here. Let's go to the next slide to take a look at workup versus workup. 1 word, 2 word. Workup 1 word, workup 2 words, which one is it? Well, the good news is that if you've got follow-up 1 word, follow-up 2 words down, it's pretty similar to that. Workup as 1 word is a noun, meaning a diagnostic study, such as the workup will include a glucose test. Workup 2 words is a verb, just like follow-up 2 words is a verb, meaning to perform the history and physical. So the doctor will work up each patient. So here the doctor is going to do something, it's a verb. Shows action, right? 2 words, workup. For our last question answer here, let's look at this one, gait or gait. Due to the patient's neurologic status, his gait was unsteady. A or B gait, which one is correct? A is correct. When we're talking about somebody's ambulatory gait, how they're getting around, how they're walking, their gait is G-A-I-T. We're almost done, I promise. Just a few additional terms that I want to make you aware of that we do hear quite often in medical reports that maybe you haven't heard outside of the medical area. So the etiology of the patient's pain is still unknown. Etiology with an E means possible causes of the problem versus ideology. That's a group of concepts or theories. The next one, the tumor was removed in toto and sent to pathology. It's going to sound like total, but it's not. When we're talking about something being removed or totally removed, we're referring to a specimen or a sample in which the entire tissue piece is submitted. It's in toto, I-N space T-O-T-O, not total. The patient will follow the drug regimen, not regime or regiment. Regimen meaning a strict systematic schedule. Regime means a period of rule or a form of government. Regiment is a military unit. So when we're talking about strict systematic schedules of something, it's a regimen. The vocal cords were visible on laryngoscopy. Here it's C-O-R-D-S, not C-H-O-R-D. C-H-O-R-D chord is what? It's like a musical chord or a musical note. As always, thanks so much for joining me this week for our lecture on our topic. And keep on track here. We're not too far off. Soon it'll be winter break and you'll be done with the semester and you can check off your classes that you're finishing this semester. I've been a student. I know how good that feels. So keep going. The light's getting brighter at the end of the tunnel. So hang in there, everyone.